Alright guys, let's tackle this NCLEX question of the day on prioritization. So a nurse is receiving a report on 4 patients. Which patient should the nurse assess first? Now remember, for these types of questions, we want to use our prioritization principles. This is acute versus chronic, something that is expected versus not expected, okay? Let's look at option A. So a 65-year-old with a history of COPD who states increasing shortness of breath only alleviated with medication. Now, a lot of people like this answer choice because COPD is airway, but let me tell you right now that airway is not always the answer specifically in these prioritization questions. Remember, we can anticipate shortness of breath in COPD. This is chronic respiratory condition. What makes this patient stable is that the medication is working and the symptoms of shortness of breath are alleviated by medications. Now let's look at option B. A 25-year-old 2 days post-vaginal delivery who in the past day has used 1 perineal pad with serosanguinous drainage. Now, in the OB world, one way to assess post-vaginal delivery hemorrhage is how many perineal pads are they using a day? Are they saturating through it? Are there big clots in the perineal pad? So this patient says they've only used 1 perineal pad and it has this serosanguinous drainage. Now, for those of you who don't know what serosanguinous drainage is, that's a very light pink drainage, okay? Sanguinous is that dark, potent red drainage. So in this situation, I'm not too concerned about this patient, so let's move on to the next option. Option C, a 32-year-old with a history of chronic kidney disease and a serum creatinine of 20. Now, do you anticipate a person with chronic kidney disease to have a high creatinine? Yes, this is an expected finding and it's not a priority. Now, option D, a 15-year-old who sustained a head trauma 2 hours ago with a Glasgow Coma scale change from 14 to 3. Now, this is a challenging question because NCLEX wants to see if you know what the results of the Glasgow Coma scale indicate. So for those of you who don't know, in the GCS, we assess 3 things: eye-opening, verbal response, and motor response, okay? The highest score you can get that is normal is 15, and the lowest score that you can get that is abnormal is 3. So if you have a patient who has a decline from 14 to 3, then that is a concern. So if I'm a nurse coming onto the shift, I know with option A, COPD is a chronic disease and they're being alleviated with medications, not my priority. Option B, post-vaginal delivery, they're not having hemorrhage, drainage is normal, that's okay. Option C, 32-year-old with CKD and a high creatinine, that's an expected finding. And option D, we have a critical decline in level of consciousness, that's my priority.